A 3-week lockdown in Sydney could be extended, with Australia's biggest city logging its largest rise in local COVID-19 cases so far this year. New South Wales State Premier Gladys Berejiklian pleaded with Sydney's 5 million residents to stay home.
New South Wales is facing the biggest challenge we have faced since the pandemic started, and I don't say that lightly.
Hundreds of extra police patrolled parts of Sydney to enforce the city's lockdown. 44 locally acquired cases were reported on Friday across the state, taking the total to more than 400 cases in the latest outbreak of the highly infectious Delta variant. Berejiklian also rejected reports that the government was considering a shift to a policy of simply living with the virus. She pointed out how low the vaccine coverage is in Australia. Meanwhile, some good news for citizens overseas. The state of South Australia will run a trial of home quarantine after criticism of the 2-week hotel quarantine. Hotel quarantine virus leaks have been the source of Australia's community outbreaks. Although Australia has kept its COVID-19 cases relatively low, its vaccination rollout has been among the slowest due to supply constraints and changing medical advice. Roughly a quarter of hospitalisations in the Sydney outbreak are people aged 35 and under, an age bracket not yet eligible for vaccinations under the government's program.